Hi and hello everyone. Welcome to GKS community. So today we have a special guest named Vidya Sagran, my colleague from MKSG Medical College. Is doing second year MD Community Medicine. So welcome you Vidya Sagran.
Hi, hello.
So how are you?
I'm good.
I
How
am
are you?
welcome you to the Voices of Community Medicine podcast. So I'm
It's
glad to
actually a good
welcome you.
initiative, and but why started with me is the question.
Because you're a most enthusiastic fellow. Vidyasakram, please introduce yourself to the audience, please.
Uh, I'm Vidya Sagran. Actually from Tamil Nadu, but now doing my second year PG residency at MKCG Medical College, Odisha. It is in Berampur.
Okay.
Yeah.
Thank you, Vidyasakran, for accepting this kind of a podcast. So, okay, without any further delay, we can go into deep into the topic. So, first, I want to ask, big elephant in the room. Everybody is asking, what is community medicine? In your perspective,
Hmm.
please.
Okay. So generally, people will think community medicine like only about going to the field and doing some education programs and some activities at the field level and means very superficial level doing papers, research papers. What paper they don't know, they will do some paperwork. That's it.
Yeah.
So, but for me, actually, community medicine is like disease prevention and health promotion. Actually, it's not only about disease prevention. It's about society. It's about the system. It's about the community. Actually,
Okay. So then why did you choose community medicine? Especially there are so many branches in medical field. Why did you choose community medicine? That is the question.
okay.
Yeah.
Okay. Means before community medicine, I done my fellowship in palliative care. Actually,
Mm.
so when I went for the training, on-site training at one institute at Trivandrum, Pallium, India. So there I was worked with one guy from community medicine. He's
Okay.
the head of social working department there.
Okay.
So there we have to go to the community and see what can be done like that. So in that way, I had a more time to spend with the guy who done the community medicine in the palliative care. Actually, I was palliative means I was passionate about palliative care, but I was my thought of getting into community medicine came there only. So there I was like, sir, I talked with him more about the palliative medicine. Then he started telling about the various aspects of community medicine actually.
Okay.
So from there I was thinking like, okay, for everything there is a problem in the nation actually. But those problems need certain solutions.
Exactly.
And
Yes.
and he will always quote that most of the solutions will be given by community medicine people.
Mm.
So that actually put me somewhat towards the side of community medicine while preparing the PG. But I was not sure about taking while taking also. But when after joining the PG, now I can tell more about community medicine. But that is the reason why I was preferring between palliative medicine and community medicine. That's how it begins. Actually, what they will do, they will go to the field and they will understand what they can be done at the field level for that family.
Mm.
And how much they can engage that community to help that family. Everything can be done. It cannot be done from the person who is in clinical setup only. It can be done by the people who go into the community. And a better person to go into the community is only us, community medicine professionals.
Yeah.
So that inspires me towards community medicine.
Okay. So okay, Vidyasagaran, just it's a good introduction to you. So just next question is, what are the pros and cons of community medicine? So what may be the
Pros and cons.
Yeah.
Okay. Means actually, as everyone will think in community medicine, work-life balance will be good.
Yeah.
The first point everyone will talk about. Okay. And
Yeah, that is actual true, right? That is actual true, but yeah, you have to involve more.
But when we are discussing about the con, again we will come to this point.
Okay. Understand. Yeah.
Okay, but those who really took community medicine as a passion, for those pros will be many actually. As we think about any research activities or any community field level activities or even clinical setup also. So here we have to break one myth is like if someone is talking like community medicine is a non-clinical, no, it is not a non-clinical subject. It is a clinical subject. So here we can see into the NCD clinics, immunization OPDs, ARC clinics, everything we can handle. In certain setups it may not be followed, but many of the setups now they started following.
Yeah, yeah.
So we can have the patient follow-up also, and we can have the ground reality also. And it is not about only community medicine means we can touch only this part of the departments only and these kind of things only. We can touch any part of the departments in the medical field actually.
Yeah.
And it is not about
Yeah, it's about
treating the
we are
disease.
covering almost comprehensively every subject, right? So mostly,
Yeah. Means integrate with any subjects in the medicine. That is the point actually. Means it can easily integrate with any subject.
okay, okay,
Not that much difficult.
okay. So what are the cons according to you? Like this may be one of the factor that most of the people hesitant to take community medicine.
The cons means main factor is, for example, if a patient comes to OPD for ortho OPD or surgery OPD, if and they are having fracture or any surgical deformity, they have to correct it. Means once the surgery done or everything done, patient will see them as a god and they will praise them. Those things will be
Yeah,
there.
yeah, exactly.
In
Yes.
community medicine, getting recognition will take you time. It may take up to months. It may take up to years. It may take more years also.
We
You will get the recognition or not. You cannot.
oh we
Even
can't
you publish
we
the
can get
paper,
instant
even you get the-
instant kind of
that
respect.
instant
Yeah.
kind of congratulation or applause you cannot get it in the community medicine. You need to be more consistent to at least to show your face to the world actually.
Yeah, yeah, yeah.
It may be like many conferences will happen, many individual talks, many workshops it may happen, but at that time also many people same like you will be there. So outsourcing from those places also tough, and you have to show off yourself more actually in community medicine, not like surgery or any clinical field. You have to showcase your talent and you have to show off your face to people. Otherwise it will be very difficult to get that recognition in this department actually. That is the main cons I will tell.
Exactly. So this is why most of the people they'll choose clinical departments over this community medicine, right?
Obviously, because when we are in the internship also we will see community medicine is one subject which is boring actually. Because they will take us to some sewage treatment plant, then they will take it to slaughterhouse, then they will make us to visit some CHC, BHC. But it is like we don't know what exactly happened. Means what community medicine is doing with that.
Exactly.
That no one knows.
Exactly.
Now after joining community medicine, we may talk about this
So once you will be in the field, then you have to know all these things, right? Yeah. Exactly.
Yeah, and maybe I am thinking like in UG phases we are not exposed more to community medicine as what is community medicine actually.
Yes.
Because we here like we cannot point out any names, but we itself seen people like community medicine is boring subject from the guys who took community medicine itself. So those kind of
that should not be done
things,
actually.
Yeah, that it is like after taking the subject we should not give up the subject actually. And those who are in those mindset, I will tell like don't take the subject. If someone in future also.
Yeah, actually they are taking like no clinical subject was there, so I took this. So this is not it should not be done, na. Actually, if you are interested, you can take. Or if you take the branch, you make it as interesting, right?
Yeah, that is what I am telling. See, I am also a student from Tamil Nadu, now in Odisha. Before joining department, I was having lot of insecurities actually. Means I don't know. Means because I don't know Hindi, I don't know Odia. Because it is not pride to tell also. It is my bad. I didn't learn those languages. Okay, but after coming to the state, when everyone was telling me to you take enough time for adaptation and all those things, but out of my interest, out of the few faculties who really encouraged me and the few seniors who really encouraged me, I also done 5 papers now, and I also got few national awards and state awards. It is not simply we got it.
Yeah, it's more of involvement.
It is more about how passionate we are towards the subject. If you are not passionate towards the subject, it is not about only community medicine. Even you want to take surgery, if you're truly passionate about surgery, then took surgery.
Exactly, yes.
Don't simply take surgery because my parents told, my seniors told, or surgery is the field. Like someone might have told this, you can earn the money easily, like that. Because now surgery is also like a field, like everyone has to do MCH.
Yes, exactly.
So
Without
it
super
is like that.
specialty,
So,
nothing is there now, till now.
without super specialty. In community medicine, another thing I can tell as a pro is now there are certain super specialties open for community medicine, but still we can have enough time with our MD specialty itself. We can learn more thing with our MD degree itself.
Yes, yes.
That
So
people are not doing, but we have to do.
yes, basically you are saying like community medicine is the branch which will, it's a bridge between the people and the government. And
Yeah, exactly.
pros is like,
because we are the persons going to the community, we are going to the field for collecting certain data.
yes, yes.
And those data is analyzed by the community medicine guy. And we are the persons publishing the paper.
Yeah, yeah.
And giving to the district authority or state authority or national authority.
Yeah, yeah, yeah.
So, for example, whatever the program, there will be a community medicine person behind it.
Exactly, yes, yes, yes.
So, that we should be proud of ourselves as community medicine specialist.
Yes, yes. The program means a national level programs and all.
Every program, even
yeah.
a small outbreak is happening. For example, any cholera or any outbreak happening, malaria, dengue, whatever it is. Obviously, the district authority will call the community medicine specialist, public health specialist. Where is the public health specialist?
So basically, you won't get an instant satisfaction. You will get more of more over the time.
See, the point
it will take more time.
You cannot get the instant acknowledgements from the people or the community. But at the end of the day, if we done our work peacefully, we will get the satisfaction very nicely.
Exactly.
So for that, we have to work with passion. That's it.
Okay, so then after the pros and cons, like after taking community medicine, most of the people hesitant like after community medicine, what will do? I didn't do anything in UG. So what are the things you're doing in PG? So what may be the activities? What are the activities in residency actually?
Okay. See, actually in UG also we will feel like only going to the field and taking photos like a camp. We will go for one holiday trip like that. That is the thought of.
That is the truth. That is the truth. That's what community medicine departments are doing.
It was portrayed actually.
Yeah.
Now the system may develop like family adoption program camps. So many areas they are doing the family adoption program with so much diligently they are doing, and they are seriously adopting the families. They are doing some good works in the community level.
Exactly.
So as a PG resident, we may have the like in our college it is like we have an initial 1 year of OPD. So we are not completely divided of patients also. So we have to see the ASU OPDs. In urban health and training centers, we will see all the non-communicable diseases. Hypertension cases will come, diabetes will come, any common fever, cold, everything will come. We will handle those cases also. And immunization clinic we are having. And beyond this OPD and these clinics, we can do the research paper, actual work. So in the research paper work, we can go for any topics we want to do also. For example, my area of focus is palliative care. So I am working more on palliative care actually.
Yes.
Means community medicine will not restrict you only to, it is like
certain topics. You whatever your interest is, you can go there. No issues. Yeah.
And we can go for a field for awareness campaigns. Awareness rallies will happen. And IEC campaigns we can do. Outbreak investigations. Few of my colleagues went for outbreak investigations. They gain knowledge. We can learn from them.
Exactly.
Actually in community medicine, we should be open. Means as the name community, we should also be like collaborative actually. The inclusive nature you should have first.
Exactly.
So that you will learn from your colleagues and your faculty, seniors, everyone.
Oh yeah. Exactly. You basically saying
you can attend many national conferences, international conferences also, state conferences. So there you will get more exposures.
Yes, exactly.
And from there you will get the PG. From the PG itself, if you improve, then if you work hard in the PGs, if you get good contacts, they will actually guide you towards the career pathway also.
Exactly.
For example, I initially don't know how to get into ICMR. When it's a community medicine means now in India biggest thing is ICMR, they will tell.
Yeah.
Then a few people after seeing the career path videos, we will think about the WHO, UNICEF, World Health Organizations. means international organizations, then NGOs. So now we have an idea how to focus on ourselves.
Yeah.
So these are the things you have to focus on, these conferences and this workshop kind of things you have to go. So these are the most common activities we can do in community medicine.
Exactly. So basically,
It's most common.
yeah. So basically, these are the research works. So in research, we are doing biostatistics. That is the most important part of research. So most of the people, they are thinking like, why we are doing max and all? Why are doing statistics in research? So what is your perception on that?
See, even now I can tell you very directly. Even we can ask our seniors or whoever. No one will do that much biostatistics and all. Nowadays, softwares are there actually. Softwares are there for doing the biostatistics. Community medicine, as a public health specialist, you have to know which statistical test you have to apply for which conditions.
Exactly.
That is the main
Yeah.
thing you have to
So
know.
that's a
It's
part
not
of
about
research.
you have to-
That is a part of research.
And there is no point about we cannot violate any chi-square test. What is the formula? Pearson correlation. Those things are
Yeah, we no need to mug up the formulas.
These are the most common I use now.
Yeah.
So we cannot remember everything in the biostatistics.
Exactly.
Okay. And community medicine is not only, and research paper is not only about biostatistics. That is the one thing. Research paper is about the novelty of your idea.
Exactly.
And
This
how
is
you are-
identify the gap. Identify the gap. Where is the gap?
And which one? See, which one? Actually, it is not about identifying the gap around your college also. Identifying the gap at national level also you can touch. Identifying
Exactly.
the gap at district level you can do. State
Exactly.
level you can do. National level you can do. Even international level, if you are that much eligible, you can do. That is the point. It is not only about biostatistics.
So even
Biostatistics
yeah.
is, the biostatistics is like 10 to 15% of paper. It may not be 10 to 15% also. Maybe I know I am the second year PG, biostatistics tough for me, I may tell it as 10 to 15%.
Exactly. Actually, we need a basic understanding about the biostats. There is no need of going to the deep, right? So we know which test has to apply in for this research,
Yeah.
right? Okay. So then after doing community medicine, what are the scopes? What will be the scopes of community medicine in the future?
Okay. So, means mainly in government sector, there are many opportunities nowadays actually. Mainly when the National Health Mission becomes the main role in many things, they are organizing many programs actually. For example, block level program managers post, those things are also now started available. And in those things, they are recruiting the people who are working in community medicine also. And international health organizations like WHO, UNICEF, then many NGOs, they started recruiting the community medicine peoples. Means many NGOs who are working on NCDs or those who are working on One Health.
Exactly.
These kind of areas also, they started recruiting the community medicine. And even now, there are certain private institutes also, they started recruiting the community medicine people for their own means utilization of services to improve their SOPs, protocols, those things they are using. And mainly as academic roles, you can join anywhere as the professor, assistant professor, associate professor, whatever, based on your qualification.
Yeah.
And in India, mainly like ICMR kind of institutes are there. And many funding agencies are there for research. So there are various opportunities for community medicine people. But we were exposed in the UGs like only in medical colleges you can work and you have to take again the UGs for trip. It is not like that.
Okay.
So there are various opportunities now available. Just we have to go explore more. Still now I am exploring. These are the things I heard from someone. That's all. Still I have 2 more years to explore more.
Yeah, exactly. So I want to ask some out of syllabus question. Like, how is your department there? How is your community medicine department there in your college?
See, for me, first of all, I am from the student from the outside state, means like Tamil Nadu.
Yeah.
So I don't know the language first. Seriously, means you know me. I don't know Hindi also. I don't know Odia also. Now somewhat I started understanding the language like 80 to 90% I can understand.
Understanding is more than enough. Understanding is more than enough. No need to speak.
Is more than enough. But still, as the community medicine guy, you need to communicate with the people actually.
Yeah, it will take time. It will take time. Yeah. Exactly, it will take time.
It will take time. Means it will take time actually. And for me, it is like when I started doing my first paper, They told, go and collect the data. Okay, I was like, how to collect the data? Which language? Means to whom I will go?
Yeah, whom I will talk. How will I talk? Exactly.
I don't know how to handle that, but I can tell you one thing. There comes the savior of my life in my PG life. Like few seniors and 2 to 3 from my batchmates, I can tell. They really came to me to the field and they really came to the ward with me. Okay, they try to understand what I want to do.
Yeah.
They try to understand the questionnaire and they helped me.
Exactly.
Even the faculties, they guided with certain seniors. You go to this senior, they will help you. They will come with you. Mainly during the OPD times, we have to go for some data collection. Means, for example, if the guy from one state collecting the data will take 5 minutes, means for me it will take 1 hour also.
Difficult, too difficult. No? Without, there's a language barriers there.
Yeah, those things. Yes. And for me, another one good point happened to me is the interns who were there in the community medicine postings. They were like gem people for me. They will be like, "Bhai, come, we will go. We will come collect the data." Means for them it is like roaming. For me, it is like learning.
Exactly.
So
Yes.
they will also get to know about the after. Means actually certain people told like after seeing me doing the work from outside state, they also told that okay, these much things can be done in community medicine. Then only I understood that as a PG, we are not communicating with the UGs also. As a PG, we also have a role to communicate with the UG students. What is the importance of community medicine?
Yes.
Rather than telling, you will just pass the exam. Means you write this, you read epidemiology chapter, you read certain definitions, you will pass the exam. We should not also do those things.
So personally,
and the other main thing is there are few faculties really helped me. Like means they really took care of me. They're like their own son, brother, like that. So they will encourage me to go to these workshops. This will be helpful for you. Go to these conferences. They will let me meet those people. They know from Tamil Nadu or they know from South states.
Yeah, exactly.
They are literally certain people were like, I'm grateful to them forever actually.
Exactly. So without any serious help
and they know
colleagues
what is our weakness also. And they know what is our weakness and they will pinpoint us. You focus on this area. This is your weakness. So you focus on this area to improve yourself.
Exactly. So basically,
the way they are guiding us towards the things, it is actually helping.
Exactly. So basically, I will say like community medicine has 4 components. First is teaching, second is biostats, third is administration, 4 is clinicals. So we will comprehensively doing all this, right?
Even biostats, you should not tell it as biostats. It is about part of research paper.
No, just see if you know. No. I'm saying like if you know biostats if you keep your biostats in your fingertip, you can help other people's. You can help other people's. They are learning also. They are earning from making a research paper through biostats. That is one of the scope for community medicine, right? So finally, last nail in the coffin, like what is the take-home message, a one-line message to the audience watching? They are hesitant to take community medicine. Just pull their socks.
Means actually in community medicine, you are not just treating one patient actually. You are means wait a minute, cut this one, I will tell again.
Okay.
Okay. Actually, in community medicine, you are not just treating the patient. Your role is to protect the entire population actually. And it is not only up to the population level also. You are going to touch the system which really can do the changes to the population. So, if you are that much passionate about bringing the change at the community level which you are living, then you should take community medicine. Otherwise, it is not about taking community medicine just for work-life balance. I will not encourage those things.
Exactly. Yeah, even a single thing, single program, single medicine is born out of the research only.
Yes, exactly. See, still now we are thinking like hypertension and diabetes is very much, people are aware about the hypertension and diabetes, and the people are very much aware about the communicable disease. We are talking. But as community medicine people, we only know what is the ground reality.
Exactly. We are the persons we exploring the reality.
Yeah. They will come to OPD and they will tell my BP is normal, why I have to take BP medicine. So still there is awareness lack is there. Even we are educated, whatever state we are from, it is not about Odisha or it is not about Tamil Nadu. Whatever state we are from the country
Exactly.
or whatever part of the nation or world also, still there is a lack.
Like
And the community medicine people role has to identify the lack and we have to identify the
yeah,
sources.
we are bridging the gap. Like
Yeah.
yeah. So I hope someone watching this video will take community medicine as a career option.
Yeah, I don't know. Means, see, now also we cannot tell we covered the main aspect of community medicine. We covered or not, we don't know. But this is just an experience from my side. I may talk certain times emotionally also. I may lose some points by thinking. Means I may lose certain points. But we can communicate more and we can get ideas.
Yeah,
from
no
these
issues. No,
videos
this
and
is this small initiation from my
Yeah.
side. No issues. We can do more,
See, and
more
another one
videos.
point in community medicine, yeah. And another one point about the community medicine specialist, we have to think about. We have to promote. We are promoting health and all those things, but we have to promote ourselves. What work we are doing, we have to promote ourselves.
Yeah, exactly. Okay,
So
okay.
that many people are not doing.
Yes.
That's one we have to focus.
Yes,
my
that's I'm
personal
surprised.
opinion, actually.
Just promote your branch, yeah. That is your branch. You are a specialist in that.
Ah.
So there is so many myths about community medicine. So we will try to break
Yeah,
all the
that's what
myths
I'm
by
telling.
doing series of
pioneers-
videos.
I'm telling you, those pioneers in community medicine, they have to come out and talk about the breaking the myths of community medicine. Actually.
Exactly. So this is a small initiation. We will do more videos
Yeah, we could.
with some more experts and
exactly.
so more my colleagues also. We'll do more videos in the
sure.
future. Thank you, Vidyasaran. I hope audience
you.
will enjoy this. So thank you, Vidyasaran, for joining. We'll do more videos.
So in Tamil style, we have
please-
to say, "Na, vanakkam."
Please be available for future also. Just give your time slot.
Sure.
Okay, you're too busy person. Okay. Thank you, Vidyasagar.
Roasting
Thank you so
over.
much. Thank you.